From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
This morning I want to talk a few minutes about sexually transmitted diseases. You see, both homosexual and heterosexual contact can put you at risk to get a sexually transmitted disease. And also, we need to see the most common STDs like gonorrhea, the syphilis. There is human papillomavirus associated diseases like condylomata, acuminatum, and there are chlamydial genital infections. There are herpes virus genital infection, and in women we have trichomonas vaginitis and chancroid, granuloma inguinale. You can also get scabies by sexual transmission and louse infestation. Sometimes bacterial vaginosis among women who have sex with women. Just having that contact can give you vaginosis. There is hepatitis A, B, and C, and sometimes even amoebiasis, giardiasis, and cryptosporidiasis, salmonellosis. And these diseases can spread through sex. Campylobacter and can be transmitted by sexual contact. I mean, it may not be vaginal, penile contact. Sometimes it can oral, anal contact. So both heterosexual and homosexual contact can put you at risk for the transmission of STDs and HIV. And all STDs have a subclinical or latent phase that play an important role in the long-term presence of the infection. So a disease like herpes can stay in the body and give flare-ups. So that needs to be kept in mind. And many times people with infections cannot have any symptoms. And also simultaneous infections with several different organisms can happen. And certain diseases you need to report to the state. So infections typically happen over a few days, and prompt diagnostic tests are needed to be done. And there is sometimes urethritis caused by gonococcal or chlamydial infection, and cervicitis in women can be caused by STDs, and epididymitis, genital ulcers caused by genital herpes simplex or syphilis, chancroid, granuloma venereum, granuloma inguinale. These can happen by presentation with an ulcer. Human papillomavirus infection like genital warts and HIV infection. Sometimes vaginal discharge is a good sign, like trichomoniasis, vulvovaginal candidiasis, bacterial vaginosis can present with the vaginal discharge. The other thing is pelvic inflammatory disease. Thank you, I will take care of it. Yeah. And the other thing is proctitis, proctocolitis, and even enteritis, because the bacteria can pass into the intestine. They can happen. Hepatitis A, B, and C, primary syphilis, chancroid, lymphogranuloma venereum. All of these can present as sexually transmitted diseases. So these symptoms are important, folks. Urethral discharge. Many times, most common infections causing urethral discharge are two: Neisseria gonorrhea and chlamydia trachomatis. That's important. Neisseria gonorrhea, chlamydia trachomatis. Neisseria gonorrhea and chlamydia trachomatis. They are also frequent causes of prostatitis among sexually active men. So many men come with prostatitis due to these organisms. So think of these organisms when you see a person with prostatitis. Same with urethritis, like organisms like Mycoplasma genitalism, Ureaplasma, Ureolyticum, Trichomonas vaginalis. They can cause urethritis. There are other causes like Reiter's syndrome. You see, in writer's syndrome, we have three things: arthritis, conjunctivitis, and urethritis. So a patient comes with arthritis, urethritis, conjunctivitis, you need to think of writer's syndrome, because that is the classic finding in those patients. And vaginal discharge, you should not leave it alone, folks. And the most common causes of vaginitis are bacterial vaginosis. I will take care of it. Thank you. Bacterial vaginosis, candidiasis, trichomonas vaginalis. Those are the most common. There are less common infections like HPV like Condylomata acuminata, or even group A streptococcus can cause vaginal discharge. And physiological changes with the menstrual cycle, most common cause. But if somebody says that they have vaginal discharge, which is unusual, then you need to think of sexually transmitted disease, especially in patients who have a risk factor for this problem. And also inflammation of the cervix can present like cervicitis along with vaginal discharge. So any person with an STD should be tested for syphilis and HIV. Remember that. It's an important point. Any person with an STD should be tested for syphilis and HIV. And even if the tests are negative, and if you have a strong suspicion of their risk factors, you need to test them again, like a serial screening in another 3 months. And you should offer routine screening for syphilis and HIV for these patients. You can do a rapid HIV test immediately, or there is nucleic acid amplification followed by confirmatory serology like Western blot in the case of HIV. So asymptomatic patients, when they request you for STD screening, I mean when they are starting with a new sexual relationship, you need to do a routine HIV testing and hepatitis B serology, because these two are very, very common when there are multiple sex partners. Sexually active women who have not been recently screened, you need to give them a cervical pap smear also. You see, Papa Nicola smear, the pap smear, is increasingly important in this age and time because of multiple sex partners, because human papilloma virus is so prevalent nowadays. So women are at risk for cervical cancer. So you need to offer pap smear to sexually active women. And men having sex with men, you need to think of even gonorrhea in their pharynx and in their rectum, and chlamydia in their rectum. And nowadays we have nuclear amplification studies. Just you can take a urine sample and test them for gonorrhea and chlamydia. So urine test for chlamydia, gonorrhea is FDA approved. You can offer that. And for all sexually active men, for all sexually active homosexuals, you need to encourage them hepatitis B vaccine. In fact, for all men, all sexually active men should get hepatitis B vaccine. And hepatitis A vaccine, you should recommend it for men having sex with men. And for women, like girls after age 9 and up to 26, between 9 and 26, you need to encourage women to take vaccination against human papillomavirus, that's Gardasil. So how do you know that you have a sexually transmitted disease? It can present with many symptoms, starting with I told you, even sore throat in a homosexual man. Probably he has pharyngeal chlamydia or pharyngeal gonorrhea. A rectal pain in a homosexual man. Probably he has rectal gonorrhea or rectal HPV. You see what I'm saying? Bacterial vaginal discharge in a homosexual woman. Probably she has bacterial vaginosis. So the point is, sexually transmitted disease is no more limited to the sexual organs. It's not just vagina or penis anymore, it's more than that. So all these symptoms with the risk factors, you need to think about sexually transmitted disease and diagnose it promptly and treat it, because we have wonderful antibiotics nowadays that are useful for STDs. Thank you very much.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.